Hi, did you just Google to find out about how to diagnose thyroid diseases? Here I am, Dr. Sandeep Nayak, surgical oncologist and a thyroid specialist, to talk to you about thyroid diseases. You must have seen my previous videos. You can subscribe to my channel and have a look at all the thyroid videos that we have created. Now let us see how to diagnose if you have a thyroid disease or not. Now, the diagnosis of thyroid disease depends on whether it's a functional problem or an anatomical problem. Functional means how it is functioning, anatomical means whether there is a defect or a nodule in the thyroid. How do we do that? Functional problem is diagnosed by a thyroid function test. It's a blood test. They'll withdraw some amount of blood from your veins and test it to see the levels of thyroid hormone. So that will tell us whether it is over functioning or hypofunctioning. Means whether it's functioning correctly, over functioning, or its function is lower. So based on this, the treatment can be planned. If it is hypofunctional, they'll give you tablets to increase the hormone levels. If it is hyperfunctioning, again tablets are given to control it. Coming to the anatomical problems, which means there is a nodule, there is something additional in the thyroid gland. How do we assess that? We do a thyroid scan or ultrasound scan of thyroid gland. And when we do that, the ultrasonographer will tell us if that nodule in the thyroid looks suspicious or does not look suspicious, which means do we need to investigate further or not. So that is the thing which we assess. Now there are further tests which you need to understand also. There is something called a radio technetium scan or a technetium scan. In a case where there is hyperfunctioning nodule, means when the thyroid is over functioning, we use this test to see where is that particular nodule which is hyperfunctioning, because we need to know what to do with it. We need to locate it and then only we can treat it. So the purpose of doing technetium scan is to locate that particular nodule so that right treatment can be given. And finally, there is a test called FNAC or fine needle aspiration cytology, which means the test person who is performing the test puts a small, very thin needle into the thyroid gland area which is suspicious and takes out a few cells from that and puts it on a slide and looks at under a microscope to know what that particular nodule contains. So these are by far the most commonly performed tests for any form of thyroid nodule. Thank you.